Good afternoon, my name is Karen and I have a condition called trimethylaminuria. I'd like to talk to you just a little bit about it this afternoon, most specifically about the cost of dealing with it, the cost to the economy of ignoring patients who complain of metabolic body odour or bloodborne halitosis. First of all, what is it? Very briefly, it's when the sufferer emits a repellent odour which is in the form of trimethylamine, or TMA for short. And it comes through the pores, the breath, all bodily secretions, the hair. And there are actually other volatiles which we emit, but they haven't been studied fully enough yet for me to talk about. But there are other volatiles besides trimethylamine. There are two main causes. The first cause is gut dysbiosis, which there is an overgrowth of pathogenic gut bacteria which feed on choline, which is a dietary nutrient that we all need. It feeds on that and it excretes TMA as a result. So we have excessive amounts of TMA being excreted into the bloodstream and then emitted. The other cause is a dysfunctional flavin monoxygenase 3 enzyme. And this enzyme, if it doesn't work properly, it fails to neutralize the trimethylamine, and therefore it is emitted. In a normal individual, the FMO3 enzyme, the flavin monoxygenase 3 enzyme, would neutralize the TMA and render it odorless into its odorless form, its trimethylamine N oxide. If it's in that form, you're fine. But if you have trimethylaminuria, you can't neutralize it, and so it is emitted. And the result is a repellent odor. The odor can encroach on the well-being of other people. It can cause them to sneeze even, or even feel sick. It is quite a strong odor, and it can't be masked with deodorant, perfume. It is, it does affect people's lives, really. So why are we special? Why is it special? Well, everybody with a rare disease is special. But one important thing about trimethylaminuria is that there is no death endpoint, and that's quite important. Obviously, we're very lucky because there is no death endpoint. But this means that unless you consider the people who have committed suicide as a result of this, unless you consider those people, there's no death endpoint, which means that when sufferers of the condition go to GPs for support, they are often treated in a way which isn't helpful, which isn't constructive. They're not taken seriously enough. And like Behçet's disease, we have no visible physical defects. In fact, sometimes people with TMAU go to such an effort with their diet and their exercise regime that they may actually look quite healthy. So when they go to the GP, again, we have a wellness bias. Oh, you look fine, there's nothing wrong with you. So we have that as well. We're also special because of the severe social stigmatization, and this is the main thing, really, which causes the problems. Because with most disorders or illnesses, there is a lot of sympathy, not sympathy, but understanding from other people. If I get on a tube and I see somebody is walking on crutches, for example, I will offer my seat. The reverse happens with odour disorders. It's considered socially acceptable to discriminate against people who have a malodor disorder. Believe you're that one. Okay, and they're also special because of our unheard voices. Unfortunately, a lot of people are highly embarrassed by the condition, which means that they don't want to speak out, and they often hide away. And when they do speak out, they're ignored. So sometimes the problem is that our community needs to be louder and speak louder. And what's the impact of living with uncontrolled malodor daily? Well, the rituals and self-experimentation. Self-experimentation to try and minimize the effects of the odor, this can be dangerous. We're talking about enemas and all kinds of things too, doing enemas to yourself and taking lots of supplements. That can be dangerous. And then, of course, GPs who encounter people with malodor disorders will send them off to do tests, etc. And most of them are irrelevant and waste a lot of NHS money, to be honest. The other thing which impacts on us is our unregulated dietary restrictions. We restrict our diets to restrict the intake of choline in foods, and we don't know what the long-term effects of this are. Choline deficiency leads to non-alcoholic fatty liver disease, but we also restrict so many nutrients. Years down the line, we'll all have osteoporosis and all kinds of things, which again will need to be treated by the NHS. So we will cost the NHS more money longer down the line, unfortunately. The negative interactions daily, if you are unable to control your load, it's very hard to talk to people and socialize, which means you will get negative feedback a lot of times. And for children, this could be so depressing that they leave education. I've had emails from teenagers who are suicidal. And it also impacts on career progression. So, you know, people are often ostracized, or their career progression is hampered because they're not promoted, or they lose their job. Sometimes they suffer harassment. And this is really important, that intimate relationships can be hampered. And for young people especially, this so affects their psychosocial development. And as Sandy was talking about mental health of people, etc., you can imagine the impact on young people who have this repellent odor that they're emitting. It really affects them, and it affects their personalities. So much so that their mental health is jeopardized, and a lot of us do go to the GP for counselling, etc., which again costs the NHS a lot of money because we need constant counselling. It doesn't go away. And finally, last slide. Yeah. This scientist in 2016 did get together a drug repurposing proposal. He wrote it all up and got it all ready, and it was to find a therapeutic agent to augment the expression of the FMO3 gene. Unfortunately, we couldn't get enough funding together in time to bring the proposal to fruition. Okay, thank you very much. It's been a pleasure.